Hello, my name is Dr. Lucas Watterson from Mountain State Wellness in Morgantown, West Virginia. Today, I would like to explain to you two scientific approaches that help to validate or explain what actually happens when the top of your neck is injured and shifted out of alignment. There are all kinds of different scientific hypotheses and scientific models that have been expressed over the 130 years that chiropractic has been in existence, but now we're getting closer and closer and closer to truly understanding what the negative and devastating effects of having a misalignment to the top of your neck causes to your brain and central nervous system. The first model is called Maladaptive Neurophysiology. And what that means is when the spine is shifted out of alignment at the top, it causes sensory mechanisms within the spine to cause abnormal movement in the spine, and then that causes abnormal feedback up into the brain, which disturbs all kinds of the neural circuitry. It could cause neurological problems like migraine headaches and vertigo. It could cause endocrine problems like hormone imbalances or pregnancy and reproductive problems in women. It can also cause immune problems like a depressed immune system or more susceptible to autoimmune diseases. So maladaptive neurophysiological model is one of the most common models right now to simply explain the global effect that having an injury to the top of your neck actually causes in the central nervous system, therefore leading to all kinds of different symptoms. The second model is called sensory motor integration disorder. Sensory motor integration disorder is basically saying that when your spine's been injured, it disturbs the balance centers of the brain, the back of the brain, called the cerebellum. And that area actually helps to deal with balance and coordination. So if someone's suffering some symptoms or injury to that particular area due to a neck injury, they're going to have difficulty with balance. They're going to have difficulty just simply walking down in a straight line, for example, or coordination with fine motor skills and things like tying your shoes or threading a needle. So sensory motor integration disorder shows that the balance centers and coordination centers of the brain and the spinal cord are being disturbed from the upper cervical injury. At Mountain State Wellness, we specialize in detecting and correcting these injuries to the top of your neck, and we correct them with a very specific, very precise, and extremely gentle procedure using our hands. We take pre and post x-rays to measure before and validate afterwards, and we have been doing this for 24 years, helping people with sensory motor integration symptoms as well as neurophysiological problems like neurological, autoimmune, and endocrine type symptoms. If you have an unresolved chronic issue that you'd like to actually get a different opinion and a different perspective, and you've also had some type of neck or spine injury, we at Mountain State Wellness could certainly help you. My name is Dr. Lucas Watterson at Mountain State Wellness in Morgantown, West Virginia.